Hi everyone, it's Philip here from Vet Education. Thank you so much for tuning in today. We're going to answer a bit of a question. Peripheral pulse palpation versus Doppler systolic arterial pressure in dogs. What's the relationship? Well, to help answer that question, we're just going to review a paper that was published by Laura Atika and colleagues in the Journal of Veterinary Emergency and Critical Care in 2018. We know that the physical detection of peripheral pulses and the characterization of those pulses, either strong, moderate, or weak, has long been used in triage assessment protocols in both humans and animals, with the assumption that strong pulses correlate with higher blood pressure, whereas weak pulses correlate with lower blood pressure. However, in humans, the study of the association between peripheral pulse and arterial blood pressure has revealed that systolic arterial pressure measurements are actually lower than expected based on those traditional correlations, and this has raised a few concerns about the reliability of pulse pressure measurements in patient assessments. So today we're just going to review a veterinary study looking at the validity of this assumption. And actually, prior to the study, there were no clinical studies evaluating the relationship of peripheral pulse to systolic arterial blood pressure in dogs, something the study under discussion aimed to rectify. Pulse quality is determined by the differences between systolic arterial blood pressure and diastolic pressure, and it's influenced by factors including both the systolic and the diastolic blood pressure, but also stroke volume, the arterial wall compliance, and intrathoracic pressure as well. So this study was a prospective observational study of 93 dogs that presented to an emergency service that had had a physical examination and a systolic arterial blood pressure measurement performed prior to any interventional therapy. The key results of this study were really interesting. What they revealed was that absent metatarsal pulses reliably predicted hypotension, that is a systolic arterial blood pressure of less than 90 millimeters of mercury. I'm going to repeat that because it's really critical. If you have absent metatarsal pulses, that will reliably predict hypotension, that is a systolic arterial blood pressure of less than 90 millimeters of mercury. Here's the other thing. The presence of metatarsal pulses does not correlate with normal blood pressure measurement, meaning that if you've got palpable metatarsal pulses, your patient could still be hypotensive. That's the other really critical thing in this study. So just having the presence of metatarsal pulses does not mean you've got good blood pressure. If they're absent, you don't have good blood pressure. If they're present, your patient could still be hypotensive. So the authors conclude that their study really highlights the importance of performing blood pressure measurement as well as doing peripheral pulse evaluation and taking into consideration other physical indicators such as mucous membrane color, capillary refill time, mental status, and temperature when you're evaluating dogs for hypotension. Additionally, the authors conclude that because hypotension is a late marker of shock, if your blood pressure is normal but you've got other clinical signs that support a diagnosis of shock, such as prolonged capillary refill time, maybe tachycardia and so on, that we actually begin aggressive resuscitation efforts before that patient becomes hypotensive. So it's a really interesting study. I hope you enjoyed that short review. Thank you so much for tuning in. We're in the middle of preparing for the start of our upcoming course on critical illness in dogs. We'll be discussing things like systemic inflammatory response syndrome, sepsis, multiple organ dysfunction syndrome, patient monitoring, and so on. If you're interested in that course, go to the website veteducation.com.au, click on Vet Courses and click on the course title and have a look through the week-by-week breakdown of the course. That course starts at the end of April 28th in fact, so it's not too much longer to register. If you do have any questions at all, you can email us for more information, info@veteducation.com.au. Thank you so much, everyone. I hope you have a fantastic day ahead.